In the novel, My Sister's Keeper, Jodi Picoult writes about a family made up of parents Sarah and Brian and 3 children, Jessie, Kate, and Anna, and the struggles of having a sick child. Anna, the youngest child, was engineered to be a perfect match and donor for her sister Kate, who has leukemia. Because of her sister's dependency on her, Anna is unable to live the life she wants. In and out of the hospital constantly, she cannot take part in extracurricular activities such as cheerleading or soccer. When Kate turns 13, she goes into renal failure. Anna knows that she will have to donate one of her kidneys to her sister. Anna Fitzgerald seeks a lawyer, Campbell Alexander, trying to hire him to earn medical emancipation from her mother, Sarah. She tells the lawyer the story of her family after the discovery that her older sister Kate had leukemia, how she was conceived in vitro fertilization to become a donor, and the medical procedures she has gone through since she was 5 years old to donate to her sister. The type of leukemia that Kate has is called acute promyelocytic leukemia, also known as APL. This is a cancer of the bone and develops when abnormal cells form in the bone marrow and replaces normal bone cells. APL is a very rare type of cancer. Only about 1,200 people a year are diagnosed with APL. That represents 1% of childhood leukemia. Most children are diagnosed with APL between the ages 2 and 3. With immediate aggressive treatment, the rate of survival for patients is 20 to 30%. There are many ways to attempt to treat APL. One way is through umbilical cord blood. Umbilical cord blood comes from the umbilical cord after the birth of a baby. Umbilical cord blood cells are the type of cells that are immature and called blood-forming cells. A blood-forming cell can form into any cell needed. Umbilical cord blood is inserted into the bone of the patient in hope of creating a healthy immune system. By creating a healthy blood-forming immune system, the blood in the body should work to be healthy throughout the whole body, eliminating the cancerous cells. If parents did not save their child's umbilical cord blood, it is very difficult to receive a match for the patient. The best method to get cord blood is to have a baby. Many parents do not think of saving their umbilical cord blood when the baby is born. It is also very expensive. The best method to get cord blood is to have a baby with similar genes as the sick child and use the cord blood from that child that was born. This is when Sarah and Brian Fitzgerald were advised by a doctor to have a baby that would save Kate, their daughter's life.
When I was a kid, my mother told me that I was a little piece of blue sky that came into this world because she and Dad loved me so much. It was only later that I realized that it wasn't exactly true. I am not a coincidence. I was engineered, born for a particular reason. A scientist hooked up my mother's eggs and my father's sperm to make a specific combination of genes. He did it to save my sister's life. Sometimes I wonder what would have happened if Kate had been healthy. I'd probably still be up in heaven or wherever, waiting to be attached to a body down here on Earth. But coincidence or not, I'm here.
A designer baby is a baby whose genetic makeup has been artificially selected by genetic engineering, combined with in vitro fertilization to ensure the presence of genes and/or characteristics. Sarah Fitzgerald had a designer baby, Anna, to become a donor and perfect match for her daughter Kate. Anna was born to save and become a harvest crop for her sister. Anna and other medical designer babies often get lost in the commotion of having an ill sibling. These designer babies do not think that their parents love them because, as Anna said, if your parents have you for a reason, then that reason better exist. Because once it's gone, so are you. Designer babies have pre-decided human genetics and feel as if they have no dignity in life. Anna has to donate other organs and go through other procedures because she has exact genetic makeup as Kate and is a perfect donor match. Anna's purpose in life is to be a donor for Kate. Although sometimes parents who are stressed have clouded views of what is right and wrong, Sarah Fitzgerald never asked Anna if it was okay to stick and poke and put her through procedure after procedure. This makes Anna feel as if she is not important.
Forget about the fact that the operation is dangerous, or that it would hurt, or that I might just not want to have something cut out of me. But if I only have one kidney, then what happens to me? What if I need it? And am I really never allowed to play sports or be a cheerleader or get pregnant? What if the transplant doesn't work? What then?
She's your sister.
I know that, but I'm not like you, Mom. Okay, I see the other kids. I see what they do. They go to parties and they get to go to the beach. Remember how the doctor said if I did the operation, I would have to be careful for the rest of my life? Who wants to live like that?
Anna,
I'm important too, Mom. I'm important too.